Hi, my name is Dr. Sergio Gito, and today I'm going to share with you 5 tips on how you can lower your cholesterol in the next 30 days. The first one is the most underrated when it comes to lowering cholesterol, and that's focus and determination. When it comes to high cholesterol, working on bringing your numbers down really comes down to your attitude and determination. In former US Navy SEAL David Goggins' book, You Can't Hurt Me, he talks about how to persevere through adversity, and he has a very interesting quote, and that's that motivation gets you started, but determination gets you to your goal. In order for you to bring your cholesterol numbers down, you're not just going to have to be focused, but you're going to have to be determined. That means mentally preparing yourself to make some serious lifestyle changes that we're going to talk about shortly, and sticking with those changes even when it becomes difficult. Don't underestimate the power of your mind and your ability to change your life based on your mental attitude and your determination. Your mental attitude towards food or physical activity likely contributed to high cholesterol. In order to reverse your cholesterol numbers, you're going to have to be mentally focused and determined in order to get yourself back on track. Number 2, come to terms with what got you to having high cholesterol in the first place. Anytime you try to troubleshoot a problem or solve a goal, the first thing you have to do is come to terms with what got you to this problem in the first place. In this case, it's high cholesterol, and there are many causes of high cholesterol that range from poor diet, lack of exercise, family history, smoking, or alcohol use, just to name a few. Unless you address the root cause of what got you to the point of having high cholesterol, you'll never come up with a permanent solution. If you drink heavily and continue to drink heavily while trying to lower your cholesterol, then you're only setting yourself up for failure. If you have a family history of high cholesterol, then you know that your diet and physical activity is going to be paramount in order to decrease your cholesterol numbers. Always address the root cause of what got you to having high cholesterol in the first place. High cholesterol is reversible, but you can only do it if you address the elephant in the room, which is what got you to the point of having high cholesterol in the first place. Number 3, exercise. This one pretty much goes without being said, but if you're serious about lowering your cholesterol, then you're going to have to maintain an active lifestyle and a regular exercise regimen. So many studies have shown how exercise lowers your triglycerides and LDL cholesterol while increasing your HDL cholesterol. If you struggle with maintaining an active lifestyle or an exercise regimen, then you're not alone. In fact, one study showed that at least 50% of people who started a gym membership at the beginning of the year wound up canceling after just 1 month. The key to avoid falling off the exercise bandwagon is to incorporate some sort of physical activity into your lifestyle by finding out what you enjoy doing. Don't force yourself to go to a gym or do cardio if you hate going to the gym. If you like to ride a bicycle, then do that. If you enjoy long walks, then do that. If you like aerobics classes or kickboxing, then do that, but do something that keeps you motivated. Whatever you do, make sure it's something that you enjoy and something that brings some sort of fulfillment into your life. Otherwise, you're going to find it difficult to stay active. Number 4, diet. Whether you think you have a poor diet or not, you will almost always have to adjust your diet in order to help maintain your cholesterol levels. The important thing here is understanding what foods to eat and what foods to avoid if you have high cholesterol. While some of us in the medical community may argue over the nuances, the general consensus is that if you have high cholesterol, you're going to have to limit certain foods, and I call these foods the Big Four, CERF: cheese, eggs, red meat or pork, and fried foods. I'll make a video detailing more about these foods later, but for now just know that these are the 4 essential types of foods that you should avoid or eat in very low amounts if you want to maintain or lower your cholesterol. All of these 4 foods have saturated fats that can contribute to elevations of your LDL or triglycerides when eaten regularly. Here's exactly what I tell my patients when it comes to CERF, CERF. Cheese. Consider swapping out cheeses like American or cheddar cheese for healthy oils like avocado, peanut, olive oils, and spreads. Essentially, anything with dairy should be swapped out for those types of oils and spreads when possible. Eggs. While eggs are a healthy source of protein, vitamins, and minerals, the egg yolk has been found to contain loads of cholesterol. If you eat eggs daily, then consider switching to egg whites. This way you can get all the protein without the cholesterol. Keep in mind that whole eggs likely won't raise your cholesterol considerably unless you really eat them daily. Red meat and pork. Red meat and pork are loaded with triglycerides, and while there are plenty of benefits to eating meat, cholesterol just isn't one of them. Limiting your consumption of red meat and pork to once a week or even less if possible is one of the best ways to help lower your cholesterol intake. Fried foods. When people think about fried foods, they think about fried chicken, fish, French fries. However, many of my patients don't realize that foods like donuts and other pastries are also fried and can contain loads of fats and cholesterol. As a bonus, some baked goods like cakes and cookies aren't necessarily fried, but generally baked in butter, and that contains a lot of fats and cholesterols as well. It's best to avoid these foods altogether as much as you can. Number 5, medications. The final thing you can do to lower your cholesterol is probably the most important in terms of cholesterol management, and that's taking medications. Look, personally, I'm a huge fan of doing things as naturally as possible, but I also understand that sometimes understanding, determination, diet, and exercise just isn't enough to help control your cholesterol numbers. If you struggle to maintain your cholesterol despite doing the things that I mentioned below, then cholesterol-lowering medications are sometimes your best option. Medications like statins have been proven to help lower and decrease cholesterol while also decreasing your risk of cerebral and cardiovascular events. Look, the end goal here is to both lower your cholesterol and avoid life-threatening changes such as heart attack and stroke. If taking cholesterol medications can help you do that safely and without life-threatening side effects, then I think it makes sense for you to take your medications to help lower your cholesterol. Lowering your cholesterol in the next 30 days can be simple if you follow these 5 steps. You should always consult with your doctor or healthcare professional to help lower your cholesterol appropriately, but remember, your cholesterol is your cholesterol. If you want to lower your cholesterol, then you're going to have to take responsibility for your own health and make the necessary lifestyle changes that I mentioned before. If you have any questions, feel free to reach out to me directly or give our office a call.